Hello and welcome to this month's board roundup from the Suffolk and North East Essex ICB. We start with an update on the dental strategy and the progress that has been made on this between April and June this year. The Deputy Director, Nicola Brunning, said a number of initiatives were gaining traction. Here's what she had to say.
The new service is going to be launching in Suffolk in September this year, which is a mobile assessment and treatment service, which is being led by Suffolk County Council and will focus predominantly on the most vulnerable populations within Suffolk. In Essex, again, a number of initiatives are underway, including young people have been trained in 15 schools to be oral health champions, which I think is really lovely. Lots of young children encouraging their peers to adopt better oral health habits. And there's an initiative in care homes called Lifelong Smiles, where care homes are accredited to deliver oral health prevention, and so far 8 homes have been accredited and more are signing up to this.
The West Suffolk Elective Orthopaedic engagement was signed off. The board asked for an update report in September. This update will address the recommendations that were highlighted by Healthwatch Suffolk, which were based on key themes and trends of feedback from the 6-week engagement. It centred on a proposal to relocate 55% of elective surgical procedures to the new Essex and Suffolk Elective Orthopaedic Centre in Colchester. The board was given an update on the SEND inspection outcome. The Director of Nursing and Quality, Lisa Nopes, said Suffolk SEND Improvement Board is looking at ways to reduce waiting times for children and young people. As part of this, plans have been drawn up to increase clinical capacity. The ICB is also reviewing commissioning arrangements to include pre-diagnostic support. Currently, diagnosis far outweighs clinical capacity, and Deputy Chief Executive Richard Watson said the ICB is reviewing the overall model of care. He also said waiting times for children and adolescent mental health services, or CAMS, is also falling. To view the Suffolk SEND strategy, visit suffolklocaloffer.org.uk. The ICB anticipates that there will soon be an Essex SEND inspection. The system is experiencing financial stress in some areas. Howard Martin, the Director of Finance, said the ICB reported in line with plan at a £2 million surplus year to date, and a £14.8 million forecast surplus to offset the West Suffolk NHS Foundation Trust's deficit. He said there was a concerning increase in cost pressures in month, which at this point is manageable, with identified mitigating actions as part of the planning process. Howard also mentioned a number of areas of expenditure to note, which included continuing care, community and prescribing. The Director of Performance, Paul Jabara, gave an overview of performance over the past quarter and gave this update to the board.
Elective recovery, despite the fact we've had some challenge around industrial action, we pretty much remain on track to delivering at 78 weeks and 65 weeks as we'd planned, which is credit to the hard work that the system's undertaken. But clearly moving into next year, we are waiting for the decisions around 52 weeks and the increased number of sort of outpatient and other elective procedures we will need to carry out as per has been announced by the current government as it currently stands. So it will be a challenge, but we'll be working towards that.
Paul also said the system is developing plans to support it during winter. Sharon Rodey spoke about the Integrated Care Partnership. She mentioned the ICP group received an update about Beat the Street during its last meeting, and this is what she had to say.
We had a presentation around Beat the Street initiative in Ipswich and Harwich, which aims to promote physical activity in individuals, families and communities. There's quite a lot of data that it generated around populations and what works. So that was shared, and there was an inspiring kind of discussion on how we could build on that approach to learn more and to use data in imaginative ways.
Sharon also spoke about a co-production and co-delivery update, as well as a presentation that the system's digital team gave about shared care records. That's all for now. The next board meeting will be taking place on the 24th of September. There's more details on the website suffolkandnortheastessex.icb.nhs.uk.